So morning clinic's finished. I thought I'd give you a quick rundown of what I saw. 4 injections. I've been away last week, so as the main injector in the practice, they often build up. But quite crucially, a lady with dementia, knee injection keeps her dancing and keeps her mobile, which is really important. An exercise professional who has de Quervain's tenosynovitis, we inject her once a year, keeps her going with her yoga classes. Someone with trochanteric bursitis, again, struggles with chronic pain, it keeps her mobile, really important, lasts at least 9 months for her. And a trigger finger, really quick and easy to do, very glad she didn't have to go to hospital for an operation. Saw someone with fatigue and bowel symptoms, very worried about cancer, took quite a while to unpick that one. Someone with a difficult diagnosis of whether it was asthma or chronic lung disease, had some spirometry, so we went through some of that and helped put their mind at rest a bit. Gentleman with end-stage renal failure, just been to see the kidney specialist, very worried about stopping his blood pressure medication because he's had previous strokes. So we had a good conversation there about actually the risk-benefit of stuff, and he doesn't have a lot of life left probably, and him and his wife know that, so much rather take the risk of a stroke than have low blood pressure and fatigue now. So we stopped his beta blockers and we're planning to stop some more of his medications. And he was really grateful and was upset that the hospital hadn't had this sort of conversation with him. All in 10 minutes, well, just about. Then we had a lady with 3 problems: gastric symptoms, pain in her hip, sinusitis, wanted them all dealing with. We had to negotiate that one a little bit and just about covered them. A 26-year-old with sudden shortness of breath, which in the end probably was a panic attack. She was struggling with a newborn baby, so we had to talk a bit about that. She was very worried about it being a clot on the lung, so we had to deal with that. Then a chesty cough, a black guy whose wife was really mostly with him to try and get him to talk about his prostate. She's heard that black men are much more prone to prostate cancer. He was, of course, trying to put his head in the sand and not think about it. So we did a very rapid shared decision on PSA testing. Probably could have been better. Couldn't get him to have a look at a shared decision tool for that one, but would have been nice if I could. Had a 12-year-old with flu-like symptoms. Phew, that was a catch-up one. Although she did have previous UTIs and the mum was quite worried about that, so we had to just dipstick and make sure there wasn't anything we were missing there. A gentleman with abdominal pain was very worried that he had a recurrence of his twisted bowel he'd had before, and then also has type 2 diabetes and wanted to talk a little bit about how he's managing that. And then finally, a 1-year-old with a skin infection that hadn't cleared up with initial antibiotics with an MRSA swab, so we had to again think about our treatment with that one. And then just one DNA out of 16 people, the one person that didn't turn up was probably the person I most wanted to see. A guy, 39-year-old builder with type 2 diabetes, really not wanting to address it at all, too busy to think about his diet or changing his lifestyle. We managed to persuade him last time just to make some small steps with perhaps a bit of a coaching approach, and I was really keen to follow him up, so perhaps I'll give him a ring in a second and see how things are going. Whew, so there we go, typical GP surgery, rattling through